This slide is to educate you about myocardial infarction. Myocardial fraction, also known as a heart attack, is one of the consequences of coronary heart disease or coronary atherosclerosis, which is the hardening and narrowing of arteries due to plaque buildup on the artery's wall, blocking blood flow of oxygenated blood to reach the heart. Certain risk factors that contribute to this plaque buildup includes the lack of physical exercise, obesity, smoking, use of alcohol and drugs such as amphetamines or cocaine, lots of stress, family history of hypertension and or heart disease, and the older you get, the more elevated your risks are. Symptoms can vary from person to person, so it is very important to become familiar with some of these signs and symptoms. The most common signs and symptoms are pressure, tightness, and pain in the chest that radiate to the arms, neck, or jaw, shortness of breath, fatigue, lightheadedness, dizziness, abnormal heartbeat, and anxiety. If you do feel these symptoms come up, then you should call 911 immediately. Each year, over 1 million people have heart attacks, and half of them die from this cardiovascular disease. There are steps that you can take to prevent this from happening. Things like becoming more active and healthy, practicing exercise like walking, some yoga, maybe some resistance or weight training for 30 minutes to an hour, 3 to 4 times a week, and that can help lower blood pressure and bad cholesterol buildup. Most physicians recommend the dietary approaches to stop hypertension, which is the DASH eating plan. This diet consists of mostly fruits, vegetables, whole grains, lean meat, like poultry or fish. It is also recommended to keep the sodium intake to about a maximum of 1,500 milligrams per day. Managing stress and weight are also key factors in preventing a heart attack. The general treatment for a myocardial infarction patient is first, the treatment starts en route to the hospital. They're giving morphine to intravenously to help the chest pain subside. They are also given oxygen therapy to prevent further ischemia. Also, nitroglycerin is given sublingually to act as a vasodilator and relax the arteries, and also aspirin to prevent any further blood clotting. Long term, the patients that have been stabilized, that survive the heart attack, have to maintain their heart healthy for the rest of their lives. So they are prescribed a angiotensin converting enzyme, which is an ACE inhibitor, to help relax the blood vessels. Also a beta blocker that blocks the effects of the adrenaline, and a statin, which works by blocking a step in the body's production of cholesterol. They will be on aspirin for the rest of their lives to help the clotting, the blood from not clotting. Also, they have to do a lot of diet modifications, but at least they're alive.